Wala siya. Wala. Wala nga. Hindi ko alam kung ano alam niya, no. Pero bakit kasi hindi ka na usapin ko? Kaya mo na. Kaya mo. Ano yun mo na, sabi niya, oo. Meron naman yung nabibigay.
Okay. Good morning. Today we are going to start with community service overview. All right. And community service overview, what are we talking about? Community service overview, mostly we are talking about who we are as community nurses. Because when you left from India, you were working in the clinics or hospitals, right? Like you guys. But now we are in Qatar and we are working as community nurses. And what does the community nursing that you will be offering now entail? What are you supposed to do? What are you supposed to abide? What are the policies you are supposed to abide to? What are the disease conditions that you are going to be seeing? And which is the rule and chain of communication that you will have to respect? Okay. Number one, I guess you know me already, right? I'm Nurse Aisha. I am the nurse supervisor. Since you're new. Okay. The National Community Nursing, Read Molly.
Community nursing involves the delivery of nursing in the community setting, focusing on promoting health, preventing illness, and providing care in homes, schools, and workplaces.
Exactly. So what is community nurses all based about? We are based on promoting health, we are based on preventing health, managing disease conditions, complex or chronic disease conditions that the patient has been suffering with for a long period of time and probably has been in a hospital stay for a long period of time. But because of the health unit and because they cannot continue to have all these people in the hospital, they have to make them a small hospital in their own homes. Okay? So you are either going to be promoting health, you're going to be preventing illnesses, or you're going to be managing complex situations, as in the case of critical ill patients. And this could be in schools, in industrial sites, in homes. But this now is for our mother company because the mother company will have all these varieties, hospitals and clinics inclusive. We are working specially and only for PNS. And the only place we are going to be working is in the patient's home. Continuation of care. When the patients cannot more be in the hospital, they will pick one of us and send that patient to the patient's home. Is that understood? Okay. And here it is equally saying that these services are being offered in the critical health unit, that is the primary health and public health initiative to support the Qatari families with the need or the nurses that they need. Because if they are to support the elderly that they have in their community, if they are to support the special needs children that they have in their community, and because these are programs that are managed by the Ministry of Public Health, it needs nurses for which they will need to be deploying to these families. And that is why you and I, we are here today. Next, we are talking about the overview of the healthcare system in Qatar. The healthcare system in Qatar is overruled by or is governed by the Ministry of Public Health, which is the MOPH, and includes both the public or the government hospital, which is Hamad Medical Corporation, and other private sectors. Now, we are based on the Hamad Medical Corporation, but for the private nursing services. Okay? And that is why you need this period of time in class to understand what you're getting into. That is why you need to understand the rules and regulations that will govern you to be able to work under PNS. That is why you are here today to know what you must have to be able to work. We already know that for us to be deployed, first, we need to be having our license as nurses here in Qatar. And number two, you need to pass your competency. Without you passing your competency, you cannot work under PNS. And that is why if you fail the second time, you will be sent to the mother company to deal with you. If the mother company do not have a job for you, they might send you back. But that is not our decisions to take. It is the decision of the management. Is that okay? Okay. From there, we'll be focusing on healthcare excellence, making sure that these families, even though the father or the mother has been bedridden for the past 5 years, their skin figure is still good, they are still fresh, they don't look malnourished, they don't lack anything, even though their breathing is impaired, they have a nurse who is a licensed nurse that is capable to offer them services that they merit. Next, we'll be looking at the rules of the nursing service, that is the PNS in the community health. How does HAMAD divide its hospital into the in-service and the community health services, which is the PNS? Now we have the community nurse key rules and responsibility is to be one, promoting health, two, preventing disease conditions, three, managing chronic conditions and improving the overall health of their patient. If you are going to be taking care of a baby, as in the care of a pediatric nurse, you'll be promoting the health of that child and preventing disease conditions, as well as you'll be taking that child to immunization, as well as you'll be trying to observe and monitor any malformation so that they can get help as quick as possible. But if you are going to be an adult nurse, you are going to be managing disease conditions such as we have asthma, we have, when I write, you write because that will be your assignment for tomorrow. We have asthma, we have diabetes, type 1, type 2, we have hypertension, we have stroke, we have COPD. Right, Habibi. I said asthma, we have diabetes, type 1, type 2, we have hypertension, we have stroke, we have COPD, we have kidney failure, we have UTIs, we have managing of bed sores, diabetic food, anemia. So for this first 5, 6, 7, or how many you've written down, your assignment is to pick each and every one of them and study them from the disease condition, signs and symptom causes, pathophysiology, management, that is, we have the medical management and the nursing management, prevention and promotion for that patient, giving yourself a goal and the nursing care plan for each disease condition. So for each day, I'm going to check one disease condition. Is that understood? For each day, I will take one disease condition. It is very important for you that you take great consideration in studying in details. Please add dementia and Parkinson. Dementia and Parkinson. There is no way that you are going to finish your classes and go for competency without meeting one of those disease conditions that have been mentioned. And your patient will have one of those. And before you are sent to a patient, we need to know that you understand completely what it takes to care for that patient. Okay, we have PNS often focus on outreach programs, home health care services, maternity and child care, management of non-communicable diseases like hypertension and diabetes. Now, the scope of community service in Qatar. When we are looking at the complete scope, what do we look at here? I have said we talk about promotion of health, we talk about management of chronic diseases, we talk about health education. Now, for the health education, what we are looking at, we'll be looking at nutrition, we'll be looking at exercise, lifestyle, smoking cessation, and mental health. How can we all together put our hands in making sure that we can help this patient in these different parameters or aspects of health? Next, we'll be looking at maternity and postnatal care. Now, we will not be too focused on maternity and postnatal care because at present we have no pediatric nurse. When we have pediatric nurse, they will have a course that will all cover what they have to do for children. And we have pediatric and maternal care, which we talk about the immunization, early detection of health issues. Next, elderly care, which is for every nurse that is in here. We are all adult nurses. The elderly care, what are we going to be focused on? For community nursing services for elder care, we'll be focusing on, one, promoting their health. For those that have been bedridden for a long time, you'll be looking at preventing any form of skin breakage. You'll be looking at making sure that they eat correctly. You'll be taking care of their total health, because some people will not be able to bathe, will not be able to stand, will not be able to walk, and you have to do range of motion, you have to bathe, you have to change diapers, you have to make sure that their breathing pattern is good, you have to make sure that their urinary catheterization and every other thing is okay. And this is you promoting, preventing, and giving them a good quality of life. Is that understood? Next, we are going to be looking at emergency preparedness. One of the aspects of health for a community nurse is to make sure that they are ready to manage or to tackle anything when it comes their way. Now, the differences between you being a community nurse and a nurse that is in the hospital is for the fact that a nurse in the hospital already has the complete team that they need. They will be having their supervisors with them. They will be having senior staff with them. They will be having all specialties with them. They will be having their doctors with them. But you will be in the patient's house by yourself, your care partner, and that patient, and all their family, because they might be homes where the family is not present. So they just come to visit on their visiting days. Is that understood? And that means you are the only one to diagnose, you are the only one to manage, and you are the only one to know when it is out of your powers to manage that patient. Is that understood? And if you have discovered that at this moment I cannot manage this patient, what do you do? Now we have number one, collaborating with other healthcare professionals in responding to the community needs. You need to know your emergency number. What is the emergency number for Qatar? 999. That is the emergency number for Qatar. Knowing this already tells you that you are one step prepared for the unforeseen. Because whether we like it or not, there will come a day where you will not know what to do or when to do it. You will not understand what is actually wrong with your patient, even after you've given them a good positioning, even after you've given them oxygen, even after you've done all what in your own mind is the best, and yet you will still not be able to succeed. So you have to call what? 999. Now, if you have called 999 and the response to your emergency, your patient is taken to the hospital, what next you need to do? You will have to contact me. Okay? You will need to inform me about what has happened, and we will diagnose together if what has happened necessitates that you open an OVA. If it needs you to open an OVA, I will inform you about it and you will open an OVA. However, when Ma'am Patricia will be taking you for her classes, you will know when and where to open an OVA. Is that understood? Okay. For the emails, here you could have my email, that of Ma'am Patricia, and that of Mr. Bassam. You can copy that or it will be given to you. Okay? You have my numbers already. I am your first line of communication for anything at all. So whether you want to communicate to Ma'am Patricia, Ma'am Tina, Ma'am Ira, or Sir Basim, you have to communicate with me. You have to present to me what the problem is, and I will take it to whoever you want to communicate to. If that individual wants you to communicate directly to them, I will come back with the response and I will give you the link to communicate with the person. Is that okay? All right. Now, communication with administration, okay. We have with the families. For every aspect, for everything that happens in the patient's home, please always put the family involved. Always put the care partner involved. If there was a scenario and the patient fell, or the patient is now developing bed sores, or the patient is having signs of urinary tract infection, or the patient is having difficulties in breathing, or you see that the state of the patient is getting worse, please inform the family. Let them be aware of the state of that patient at all moments. They might be calling you time to time. Please give them the audience to explain to them exactly how their father or their mother is at present. Is that okay? You will work with a care partner at all times. A care partner can either be a maid or a nurse assistant that has been hired by the family, or one of the children of that father, or one of the children of that mother, or it might be the parent of the child that you are taking care of. Okay? When you have a care partner, make sure your care partner has sufficient amount of education to manage that patient with or without you. And at all moments, tell them what is in progress. If the medication had finished and you need to request, tell them. If the patient, maybe yesterday the patient was not agitating and today the patient is agitating, let the care partner know. If the care partner is a nurse assistant, she will be with you at all moments to take care of that patient, so she will know. But if the care partner is the mother or the child of that patient, they will not know because they will not be with you at all moments. Is that understood? So when they come, you should put them in line to what is happening with you. Okay. We have our hours of duties. Now, first off, we work for 12 hours. Either we are doing morning shift or we are doing night shift. And the shift that we pick depends on the family. That is to say, when HMC or when PNS has submitted a file for a patient to us, and you have to go for that patient, we will go for home risk assessment and initial assessment. And during the home risk assessment, the family will tell us that we want the nurse to work for morning from 7 to 7, or from 8 to 8, or from 9 to 9, or from 10 to 10, and or from 11 to 11. Those are the ends of the time period that you'll be working. Is that okay? It is either going to be AM or PM. If they say PM, you are going to be doing night shift. Now, if they say AM, you are going to be doing a morning shift. This is where it becomes difficult or a little bit complicated for you or for me. These are our service hours. We are taking a service provision of 24/7, and if for a service provision for 24/7, there are 2 primary nurses and 1 reliever, or 2 relievers. For a service hour for 24/6, There are 2 primary nurses with no reliever. For a service hours for 12 on 7, there is 1 primary nurse and there is 1 reliever. And for service provision for 12 on 6, there is 1 primary nurse and no reliever. What does this mean? 12 on 7 service hours or service agreement means that the nurses will be working for 24 hours, 7 days a week. And if they are working for 24 hours, 7 days a week, they need 2 nurses to work 12 hours, and they need 1 reliever because these 2 nurses will have an off day, and that reliever will work on the days that they are off. It means that if you are going to be 2 nurses working for the same patient, and you have 1 reliever, it means you will go off on Friday while she will go off on Saturday. And when you are not off, when you are off, I will send a reliever to work with her. And when she's off, I will send you a reliever to work with the reliever so that she can go off. Or I can give you guys 2 relievers in such a way that the 2 of you will go off on Friday and the 2 relievers will cover for that day. Is that understood? Or the 24 on 6 means that the individuals are going to work 24 hours for 6 days. The family will have to pick a day that they want you both to go off. And that day will be between Friday and Saturday. So if they choose Friday, it means Friday the 2 of you will go off and you will resume work on Saturday for 12 hours, making it 24 hours. For a 12 on 7, it means that the patient will be having 1 primary nurse and 1 reliever, and that means they will be working for 12 hours a day for 7 days. Or for 12 on 6, they will be working for 12 hours for 6 days. It means it's just going to be 1 nurse. The 1 nurse will work for 12 hours and will have a day off, which is either going to be Friday or it's going to be Saturday. Is that understood? So if I tell you that the service agreement that you have for your patient is 12 on 6, you already know what that means. Or if I tell you it's 24 on 7, you already know what that means. Or if I tell you it's 24 on 6, you already know what that implies. Is that okay? All right. If we leave from there, we already spoke about us working 12 hours. Okay, one more remark. For the people that will be working 12 on 7, it means 1 person will work in the morning and the other person will work in the night. For a month, I will draw my roster. The person that is working in the morning will work morning for 1 month, and the person that will work in night will work night for 1 month. And the next month, I will switch. However, if you are working 12 on 6 and that family wants you to work for night shift, Habibi, I'm sorry. There is nothing I can do about it. I cannot change you for a morning shift, and I cannot change you as a nurse for that patient. Because if HMC has given you a patient, I do not have the right to change whoever they have given, you or the patient. If the patient has a problem with you, the patient will have to go back to HMC, will make their complaint, HMC will get back to me, and I will change you. If I have a problem with you and that family because of something that is maybe an abuse or any kind of physical or emotional abuse, I will make my report and I will send to HMC. HMC will have to investigate, and then they will get back to me approving you to be withdrawn from the family. So it is not me. You can't tell me that because you are working 12 on 6 and you have been working night for the past 3 months, you need me to change you. I can't. Is that okay? So be prepared from now. If you are going to be a night duty nurse, then you have to understand that your mornings are meant for you to sleep. Not for you to move around, not for you to work more than you need, not for you to do an extraordinary something, because you will need your energy to go back on duty in the evening. And if the patient chooses for you to do morning duties, you can't tell me that you're tired from getting up in the morning at 6 a.m. to go to work. because I do not have the powers to change. As the family has indicated what they want, I always gather that information on the first day and I send to Hamad. Hamad will go through all what has been discussed between us and the family, what they want and how they want it, and they will establish an agreement, and that agreement will be signed. Okay? That agreement will be signed by the company and by HMC. And when the agreement is signed, nothing can change on it. It will take another long procedure to get any change. Is that okay? So don't say I am the one putting you for night. I am not the one putting you for night. If the family has agreed night, night you will be working. The only people that I can give them a switch and give them a change if it is a 24/7 service. Are we communicating? Okay. All right. As you are ready, you already know the company is providing you with accommodation, with transportation, to and back from work, and you are equally provided with 3 sets of uniform. You have measured your uniform already, right? Has it been given to you? All right, I've not equally had any updates of that. We will check on that. They will give you 3 sets of uniforms. You are the one to manage those 3 sets of uniform and make sure that they are clean and capable of taking you for 6 days a week. Is that understood? Okay, we have HMC standards of care. Now, when we talk about HMC, what is their standards of care? What do they expect us as community nurses to do? And how do they want us to do it? When we leave from here, we have all patients are given holistic care without any form of discrimination, without any form of negligence, without any form of abuse. Now, the worst abuse that we can get is from a nurse to their patient. Simply because you feel or you think that that patient does not deserve to have a certain amount of care. Please, if you have or if they investigate for any reason or the other and they realize that you have been abusing your patient in any way or the other, it will not be at the level of the company to decide what to do with you. It is going to be at the level of the government, and that will be in court between you and the family. Is that understood? So at all moments, you must take care of your patient without any discrimination, without any negligence, and without any abuse, as though you were taking care of your own mother, of your own father, or of your own child. Next, you must be able to identify if the family or the care partner that you have been assigned with is abusing your patient. Now, let's say that you are off. You were off for Friday, and that means that you stop work on Thursday in the evening, and you will be starting on Saturday in the morning. When you arrive on duty on Saturday, you realize that the patient has bruises on maybe one side of the body or on their whole body. Does that give you an alarm? It needs to give you an alarm to make you understand that something is happening when you are not there. And you must investigate, and you must open a report to make sure that this incident is completely investigated and you sure that it is not an abuse from the family or from the care partner. Is that understood? If you fail to make this report, and maybe the family comes and realize that their father or their child is in a bad state in the hands of a state registered nurse, you will have to explain that in the court of law. Is that understood? Okay. You must respect all 5 competencies, all 5, at all moments. Now we will get to understand what the 5 core competencies are that we will be studying up to a month, and then getting the competency exams and the 5 core competencies that we'll have to incorporate in our duties until the day we decide not to work in Qatar. Okay, and we will equally have to follow all policies with respect to the health of the patient. All. They will be sending you policies, and each policy you will need to understand what is the binding rules that you must follow. For tracheostomy, what is the policy for tracheostomy? For patient with diabetes, what is the policy? For care for a patient with COPD, what is the policy? For care of patient with maybe say shampooing, what is the policy? Care of patient with bed sores, what is the policy? You need to understand each policy, and for each and every day that you are here, you should read one policy a day. Is that understood? From there, we'll be looking at the 5 core competencies. Now, this is what we all are here in Qatar for. If you do not understand your 5 core competency as a nurse, then it is better you don't be here and you don't practice. And what are we looking at? We are looking at number 1, physical assessment. As a nurse, you should be able to conduct physical assessment to your patient. Now, is physical assessment the only assessment you have to do? No, you must be able to do total assessment of your patient. Immediately you are taking off shift, because you want to be sure that the shift that they are handing over to you, the patient is in good health, the patient is in good state, the patient is alive, and the patient is ready to work with you. You don't go and take a patient that has been abused the previous day without asking any questions, and then you are worried when they now come to ask you questions, reasons why your patient is the way they are. Number 2, we'll be looking at pain assessment, management, and reassessment. How, as home care nurses or community nurses, how do we assess for pain? How do we manage pain? And how do we reassess pain? Number 3, we'll be looking at communication by ISBA. If there is a scenario, if there is an emergency, how do I communicate this emergency to my care partners? How do I call the HMC or the home health care office to tell them that my patient is having this situation? From where do I start and from where do I end? You must be able to respect your ISBA to get that complete communication and to get the doctor or the home care nurse coming to you. Is that understood? If you fail to communicate properly, then they might not come. You are not the only nurse with a problem. There are 15,000 of nurses struggling to call at the same time, struggling to get to the home office, struggling to get a doctor. So until you are able to give them a reason for that emergency, you might have to go, they might have to drop your call and ask you to reassess your patient before calling back. And that minute, that second, might be just what you needed to save that patient's life. Is that understood? Next, we'll be looking at medication management and administration. Here we'll be looking at the rights of medication, medication checks, medication expiry, refill dates, and everything, when to give what. If the patient is having insulin, what must I respect before I administer insulin? If the patient is having medications that are once a day, twice a day, 3 times a day, maybe medications that are being administered once a week, how do I make sure that I respect every medication right, administer the medication, and manage the afterward? Because it's not just that you are administering medication. What if there are complications? What if there are side effects? What will you do? As much as a medication is capable of helping the patient, the same medication is capable of killing the patient. If I am going to administer insulin, and upon checking my patient's vitals, I realize that the patient is hypoglycemia, and without understanding the effect, without understanding the importance, I go and administer my insulin, what will I do to that patient? I will kill the patient. Now, it is the same medication that was meant to normalize blood sugar level has now killed the patient. So I must be able to know at what time, at what moment should I administer? At what time, at what moment should I start managing? I should check my vitals before administering, and I should check my vitals after administering to make sure that the purpose for which I administer my medication was achieved or not and needs reintervention. Is that understood? These 5 competencies will be taken in details by Madam Patricia. So you need to be prepared, and you need to go lightly studying what all of this entails, because this is going to be your own hole in the hands of a farmer. Is that understood? Okay, we will equally talk about disease prevention, infection control, and prevention. For you to be able to manage care, for you to be able to take care of somebody, we should be able to know how to control infection and how to manage, so that we do not act to what is already there. You are taking care of a patient that has a urinary catheter. If you cannot manage, if you cannot control, if you cannot prevent infection, you are simply going to add to that patient's problem. If you are managing a patient with a tracheostomy, if you cannot prevent, if you cannot control, you are going to add to that patient's problem. We don't want people that act. We want people that can control. We want people that can prevent. Okay, so now with the 5 competency, it holds the key for which you will practice in Qatar right up to the day you decide, I don't want to practice anymore. Everything you have to do will depend on your 5 core competencies. From there, we will have 2 chances to take the competency exams. After these 20 days, you have 10 days to go for shadowing. After the 10 days for shadowing, you have another 5 days. After the 10 days for shadowing, you have 2 days for which they will prepare you to take the competency exams. And these period of time for this preparation, if you fail the first time, you'll be given a second chance. And if you fail the second chance, it takes a longer period of time for us to be able to send your document to go for competency. Okay? And that period of time is 6 weeks to 2 months for you to be in class to study, and we make an email indicating to PNS that you have learned and what you did learn, and that this time around you will make it. If not, you have just 2 chances, because the third chance, who is going to wait for you for 2 months? Of course. So after the second chance, we have been here, we have experienced what happened last week. If you do not make it, we are going to send you to the table of the administrators to decide whether they are going to send you back home, or they are going to send you to any clinic, any hospital, any school, any community, wherever they decide, that will be your fate. But you will not work with us, because our program has rules and regulations, and we are following each and every one of them. Is that understood? Okay, and for every pass of competency, we will send you for availability, except for the fact that we don't have a reliever. If we don't have a reliever, then we are going to keep you as a reliever. Is that understood? We will consider Jacqueline is still working in the office, even though she has passed her competency. But because we have no reliever, we have to keep her as a reliever. And now for this week, those that will be going for competency, if they pass, we will add all of them and send again for availability. Is that understood? Okay. Now we will look at policies, rules and regulations, what we should do, what we should not do, how we should do it. The first thing you should understand is that your license are bound by laws, by rules, by policies that are to benefit the patient. For every right that the patient has is the responsibility of the nurse to carry out those rights and respect them. Now we have the patient has the right for confidentiality, and it is in your responsibility to respect and make sure that whatever document you have, they are fully respected for it. Now, what is confidentiality? This involves protecting personal and sensitive documents or disease conditions or medical files or diagnosis of patients by the health provider who is involved in their care. And if you must give out this information, you must give out the information to the people that are directly involved in that care. It means that if you're taking care of the patient, it will be okay if you are calling the home office to tell them about the fact that your patient is having this, and this, and this, and you are giving the medical record of that patient for the better management of that patient. It will be okay if you are sending me an over and giving me information about this patient and telling me what is going on in the patient's home. However, if you breach this confidentiality by taking pictures, by taking files, the medical document, and sending it to someone on social media, or sending it to one of your family members, or sending it or using it as a purpose of whatsoever that has nothing to do with those people, if that family discovers, your license will be seized from you. Is that understood? That is if only it will end only at the stage of your license being seized. Now, we have key principles. We have number one, respect of patients' autonomy. Patients have rights and responsibilities. As much as they have responsibilities, they have their rights. And number one right we have as, read, Shamsa. Yes. The first point under respect for patients' autonomy. Patients have the right to who has access to their health information. It means that a patient can decide to tell you that even though you are taking care of me in my home, this particular child or this particular son or my husband or my wife has no right to see this information, and you have to respect that. Is that understood? Go to the next.
They have the right to access their documents except it's against medical advice and to participate in their care.
Exactly. They have the right to participate in their care. As much as you are giving them medication, they have to swallow. As much as you are giving them food, they have to eat. As much as you have to bathe them, they need to accept that you bathe them. As much as you need to clean their wounds or their bed sores, they need to accept and comply and give you the time that you need to do this. As much as you have to do range of motion exercises, they need to give you the opportunity to do this range of motion exercises. Do you understand? As well as what? They need, if the patient is not capable of checking or seeing what is on their medical file and against medical odds, the family or the husband or the children tells, we do not want our mother to know she has cancer, or we do not want our mother to know that she has any terminal disease condition. We do not want our mother to know that she has brain tumor. You have to respect that. And you must guide your files with your whole heart. It must be in a cupboard, it must be locked, and the keys must be in your pocket at all moments, so that the patient should not open and read without you knowing. Maybe you just stepped out to get the patient water. Is that understood? So on each and every file, when I combine your patient's file to give you, I will tell you if the patient has anything, any health condition that goes against them, knowing exactly what they are suffering from. As much as we want the patient to know what they are suffering from so as to engage completely in their care, if the family do not see that, you have nothing to do about it. Is that understood? You must give them the opportunity to do what they want and how they want it. Next, read. Exactly. And this comes when you want to draw your care plan. When you are drawing your care plan, you will not just draw your care plan and say that I will give the patient a bath in the morning at 7, and by 7:30 the patient will do this, except for medications that has been given specific time for it to be administered. Then you go and respect those hours. But for bathing, for eating, for breakfast, for prayer time, let the patient tell you when they want to have their shower. If they want to bathe in the morning, so be it. If they want to bathe in the afternoon, so be it. If they want to bathe in the evening hours, so be it. You should always ask when they want their breakfast, when they want their lunch, when they want you to do range of motion exercises, when you have to go out for ambulation. Let them be involved so that they are actively doing it and they are happy to do it. Because when you do it on your own accord, they will get mad at you, they will shout at you, they will curse you out, and every other thing with your patient will not go well. Is that understood? Read.
Number 2 is professional and ethical obligations.
Professional and ethical obligations. Now, according to the American Nursing Association, with respect to confidentiality, it does not just happen here or only in Qatar, in your home country, in my home country, in her home country. Let's say in my home country, somebody is suffering from HIV, and it is the boyfriend of one of my neighbors. And I happen to tell my neighbor that the boyfriend is suffering from HIV simply because I was given an opportunity to check the medical files. What do you think will happen to me? If then my neighbor goes back to the boyfriend to tell the boyfriend, she said you are suffering from HIV, do you know where they will keep me? The person has every right to put me in jail the next day. So even if the confidentiality is something that is going to break your bones, you are going to keep it. You are going to endure. And you are going to respect it as long as it is for the good of your patient. You owe nothing to that neighbor. You owe nothing to that friend. You owe nothing to any other person, but to that patient whom they have put in your care for you to respect their health. Is that okay? Okay. Next, read.
Need to know basis. Share patient information only with healthcare professionals directly involved in practice.
Okay, next.
Informed consent. Obtain patient consent before sharing information unless it is required by law.
Exactly. And now, informed consent, apart from sharing documents, whatever you have to do in the patient's home, ask for consent. If it is time to bathe, tell Mama, I want to bathe you. Are you okay with it? If it is time for lunch, ask Mama that it is time for lunch. Are you okay to eat? If it is time for you to go for ambulation, ask Mama, it's time for ambulation. Is it okay with you to go for ambulation now? If it is time for prayers, ask Mama, I want to remind you about your prayer. Are you willing or are you ready for your prayers now? Let it be consent upon consent at every given step. If it is time for medication, tell Mama it is time for medication. Please, I will wish to administer, and she should give you the consent. I tell you, for every right, the patient has the right to refuse. And if you do not approach them nicely, if you do not pamper them, they will refuse. And if they refuse, what do you plan to do? The patient is having hypoglycemia and you need to give sugar. And the patient says no. What will you do? The patient is having hyperglycemia is at 500 and you want to give insulin and the patient says no. You are in the patient's home, only you and the care partner. What will you do? Speak correctly, please. Will you just call the ambulance immediately the patient says I don't want to take this in? What will you do? Sorry? You will give health education. You will counsel the mother, you will counsel the father or the child, you will give them the importance of which they need to take that medication, you will give them the purpose for the medication to be administered at that time, and you will give them the benefits and the effect if they don't take the medication. You must do your part first as a nurse. And if they refuse to continue to take the medication, you get back to me. Is that understood? And for each and every home, there is always a camera, because we are now just talking about the case of refusal. There is equally the patients that suffer from dementia. You have given them insulin, and then they forget. And then they remember later that they haven't taken their insulin, and they start insisting that you must give them insulin. You must be able to be as sweet as sugar. Your mouth, your tongue should communicate nothing but kindness, but love and care for that patient. So much so that they should listen to you with keen attention. Where, Mama, I have administered your medication. I am telling you, you took the medication, and this is proof, and this is proof. If I give you this medication again, it is going to run down your blood sugar level, you are going to be hypoglycemic, and you are going to have this complication. So please, just allow a certain time pass. I will give you some food, and I will check again. Please, Mama, you need to take your insulin because your blood glucose level is too high. And this is what I mean by your blood glucose level is too high. And this is how you're going to be feeling if you don't take this medication. And if this is going to be the complications if you don't take this medication. And if you take the medication, this is how good you are going to be feeling. You need to understand. And that is why you must understand your disease condition from beginning to end. The patient's health and all diagnoses that the patient is suffering from, you must know the totality of their disease condition, of how the organs and the aspect of health is balanced and now that is imbalanced. Is that understood? Okay, we have best practices. We have best practices. Number one, secure handling of records. Store physical records in lock cabinets, use passwords or electronic lockers. Avoid unauthorized disclosure. You cannot talk about the patient's health in the patient's kitchen with housemates or cooks. No. You cannot go and then now you are in the elevator and you are trying to discuss about the patient's health. No. You can only talk about the patient's health in the patient's room with the care partner and the family. And if you want to take over shift in case there are two nurses and you realize that there is a family member around, if that family member is not directly involved in the patient's care, please wait till they go. Or kindly ask them that you want to take over shift and they can excuse you for some time and then come back when you're done. Is that understood? Okay. From there, we'll be looking at professional communication and we'll be looking at patient's privacy. Professional communication, I already said, there are channels of communication. You either communicate with me through emails, through WhatsApp, through calls. If you don't have a call, just leave me a message and say, Mom, I should call you. I'll call you back immediately I see your message. And number two, you equally have a professional communication. You must not and never use anything social media in the patient's home. Filming how you care for your patient, filming patient's documentation, filming any kind of dance moves or dance anything in the patient's home. No. Do I say that you should not use TikTok? No. Am I saying that you should not use Facebook? No. Am I saying that you should not use YouTube? No. Because actually we want nurses to be out there to be able to put in their own positivity and be able to train the community on what and how to manage their health. But when you want to do that, you should have clothes on duty. You should be in your house. You should not be in your uniforms. And you can do whatever you want to do. Is that understood? So if I meet you on TikTok live, giving an educational talk for what diabetes, hypertension, whatever, and I have time, I will join you and we can give the talk together. However, you shouldn't be in your uniform and you shouldn't be on duty. And nothing in that talk should relate or reveal your patient's identity. Is that understood? Okay. Now, for patient's privacy, you maintain modesty during care provided, of course. You will not be going to bed a patient, having given a patient bed bath with other family members in the same room, right? You need them to go out, and then you can do your duty. As well as ensure patient's conversations are held in a private space, which is the patient's room. Next, consequences of breach. For everything that is good, if you don't respect it, there are consequences. I always say, doing good or doing bad, it really does not matter. What matters is, if you accept the consequence of whatever you have done, then it's okay by me. Now, the consequences, number one, your employers will sanction you. Now, before I ever report you to the management for something you did wrong, it means you have done it for 1,000 times. Okay? And when you have done it over and over, I will issue you a warning letter. The first warning letter that I will issue to you will be between me and you. Number two, if I have to issue you the second warning letter, it will be between me, you, Sir Bassem, the manager, and the HR. So each and everyone will have their signature on that document, and each and everyone will know what you have done. And if it gets to that level, a portion of your salary will be deducted, depending on the gravity of the crime. And it is not for me to determine how much they will deduct. I will simply indicate that a portion of your salary will be deducted as penalty. The management will decide what they are deducted. Next, you will have or you might lose your license. Next, you will have termination. First, if you lose your license, you cannot work as a nurse. And if you cannot work, we certainly cannot keep you. So if you lose your license, directly your termination is short. One ticket back to your home country. Is that understood? Now we'll go to the second one, legal penalty. In the cases where it is not just us as a company, but now it has involved the law, then we completely are washing our hands off your case. You will have to face that case with the law. And the law will take you, they will fine you if they want, they will send you to jail if they want, and they will deport you from the jail to your own country. That time we will not even have anything to say. Is that understood? And for the next, first, if you already go through that one, this one will never exist. So maybe say we will start with the damaged relationship between you and the patient. Because if you already breach the patient's confidentiality and trust, you will start having a broken relationship with your patient, and that is going to impair your duties, and hence is going to cause the subsequent things that will happen at that time. Is that understood? Next. Okay. At home, they are the presence. Okay, now we'll be talking about what you have. For every home, there is a CCTV camera. A CCTV camera for every home. And now for the homes that will not have, we are going to request that they do. Because it is not just for their good, that they are able to see that you are doing a marvelous job. It is equally for your good, that in case something happens, we are able to vindicate you. We are able to see that you did not do it. Because it will be your word against the word of the patient. or your words against the word of the care partner, or your words against the word of the family members. So let there be something that we can see that you did not do it. Is that understood? So when you go to the patient's home, you should be mindful with the things you say, with the things you do. And the only thing you are permitted to do is conduct your holistic care to your patient at all moments until you leave. Is that understood? Now, referral, steps for referral. When we are talking about referral, what are we talking about? Referral is the situation whereby you realize that your patient is in crisis and you need that patient to go to the hospital. You have been caring for your patient and now you are seeing signs and symptoms of urinary tract infection. You have been caring for your patient and now you can see that the tracheostomy site is infected. The stomy site is infected. You have been caring for your patient and now you realize that the patient is having bed sores. The diabetic food that the patient was suffering from is getting worse, is getting necrotized. What do you do? How do you refer your patient? Read. Number one, assess the need for referral. You must be able to understand why you need to refer the patient. And please, the home office already knows the patient's diagnosis. I'm not saying that you will not include the diagnosis when you are making your call, but it should not be because of the diagnosis that you are calling the home office. You should call the home office because of an emergency, something that is happening, either aggravating the disease condition or something that is new. Is that understood? Okay, next. Start. Yes. Need for specialized care or diagnosis. If you are looking for an internist, if your patient was suffering from, say, diabetes and hypertension, and now you realize that the patient is now having chronic constipation or stool that is mixed with blood, and you think you need an internist, you should be calling and getting a specialty from an internist. It means your patient is not going to be referred to the same hospital or to the same doctor, but should be referred to the doctor for whom you have seen deemed fit. Is that understood? If your patient says that, if we say that your patient was having diabetes and now you realize that your patient is going blind, that is something different, right? You should identify the specialty that is needed for that care. Next, read. Inability to manage. I should be talking about the signs and symptoms that I have identified. I should be talking about my assessment. I should be talking about my management. I should be talking about my evaluation. I should be talking about my reassessment. What did I find? How did I manage it? How did my evaluation, what was my evaluation? What was the result? When I reassessed the patient, what did it give me? And then you call. Because at this moment, you are now saying, this is not anymore in my powers to manage. You realize that upon auscultation, your patient's lungs are dull. You are diagnosing pulmonary edema. This is not in my capability. This, I cannot care for this. You are calling. So identify where you are unable to manage and how you want to do your referral. Because I am insisting on this, when you will be out there for competency and you said I need to call, they will ask you call for what? What you are calling should be the thing that you cannot manage. If you can manage it, of course, do the management. So when you say I want to call, make sure that the scenario that you are trying to call is a scenario that you first of all have tried to manage. It's a scenario that after your evaluation and re-evaluation, you realize that it is getting worse and you cannot more manage. Your inability to manage is the reason why another person's expertise starts from there. Next. Emergency care requirements. Let's say that you are taking care of the patient and the tracheostomy tube comes out. What is your emergency care requirement? What would be your emergency care requirements? First, we should give the oxygen. Yes. How? With the mask. Yes. And cover the tracheostomy side with a sterile gauze. Good. And call the emergency line. And when you are calling the emergency line, what must you be prepared to hand over to them or to hand to them when they arrive? No. The new tracheostomy set. Okay, those are your preparations. You will need to give oxygen using the face mask or use it with an ambu bag. You will need to cover the site with a sterile gauze, making sure that it is not a pathway for disease for transmission of infection. You will need to prepare for every individual that is going to be given a patient with a tracheostomy or with a stoma or with a urinary tract indwelling catheter. They will always give you a set, a new sterile set kept at the side of the patient. For in case there is an emergency, when the emergency unit comes from the hospital, they will either act by putting it directly or they will take the patient, but it should be available for them to decide. Is that understood? Okay. Now, obtain patient's consent. We've talked about patient consent. Obtaining patient's consent for everything that you need to do. And when we talk about the referral and obtaining patient's consent, if it was a normal state that you just carry out your care and you realize that the condition is getting worse, let's say the patient was on metformin, and then you realize that the patient, while on metformin, the blood sugar has not been coming down, instead is skyrocketing up, and you want the doctor to give you insulin. You need to first of all discuss this with the family and make them see the need for which the patient needs to have insulin in combination of metformin or insulin only before they will start metformin on another range. And when you talk this with the patient and they see